first on ones that can be treated um, with medication. So bacterial sexually transmitted diseases, chlamydia, gonorrhea, syphilis. Trichomonas isn't bacterial, but there is a medication to treat it quite easily, and you can get rid of it once you've had it. Um, and then I think those are the main ones. So these STDs, it used to, the whole thing about it is, man, at least there's a drug that can treat it, right? Like you can get rid of it and never have it again. Unlike herpes or genital wart, HIV, those are sexually transmitted illnesses that stay with you forever. Some are associated with cancer. The ones that could be treated with drugs is kind of like, okay, if you got it, it stinks, like you definitely need to rethink your sexual activity. However, at least we can treat and get rid of it. Now, there is a problem. Because there has been such an increased incidence of people getting these diseases over time, that we are having more and more incidents of drug-resistant infection, specifically gonorrhea. There's only one drug left on the market that is 100% reliable in the treatment of gonorrhea, and that is Rocephin, which is a second generation cephalosporin. If you are allergic to Rocephin and you have gonorrhea, they will give you a fluoroquinolone, and that is about 80% reliability. It kind of stinks, right? 80% reliability that you're going to be cured of gonorrhea, which can cause a lot of harm, specifically with women, known as PID, which can cause infertility. So that's really scary. Drug resistance can occur because of people not, being treated correctly, and also just because it's been treated so much, the bacteria gets smart and learns how to fight said drug because it wants to stick around. So that's something to keep in mind. We are actually approaching this time where we might not have good antibiotics for STIs. And that's something, I educate on. I tend to get a lot of patients with STIs and STDs, and some people tend to be very relaxed about the approach, like it's just part of their life, that they will constantly be getting STDs because they don't want to use condoms, and explaining to them that, the more often you get treated for this disease, the higher likelihood that one day the treatment won't work. And that's not just to because you want to scare them, but you really want them to be aware that there might be a time in their life that we can't get rid of their gonorrhea and they can get very sick. Now, other STDs we worry about that can stay with you for a while. So HIV, obviously, once you have it, you can't get rid of it. It's been really great, even in the last 15 years. The treatments for HIV have been advanced so quickly that, people live a long time with HIV. However, they are finding more and more resistant strains to certain medications with HIV because the virus is starting to mutate. And that's really scary. Then they found a direct link of HPV. So HPV, there are 100 different strains of HPV, human papillomavirus. There are 4 types that are mainly connected with sexual activity. So, hold on, I know this. 8, 16, 64, and another one, HPV. 2 of which are more incidental, associated with warts, and the other 2 are associated with cancer. Now, with the Gardasil vaccine that they start at a young age with children to prevent HPV, so it makes you strong to fight HPV, has actually decreased the incidence of cervical cancer. The problem is a lot of people think if you give a Gardasil vaccine to people, it's saying it's encouraging sex, but studies have shown that it hasn't increased the rate. There's no incidence of increased rate of sexual activity. And this is what I like to tell my patients when they're considering their Gardasil vaccine, well, especially with their parents, is I like to say to them, here's the deal. Even if your child doesn't have sex till they get married, if their partner had sex once and carry HPV, then they're still at risk of getting a genital wart, and they're still at risk of getting an HPV type cancer. And then you'll miss the window of being vaccinated because you have to do the vaccinations young. HSV is genital herpes. There's two main types of HSV. There's HSV1, which is the oral herpes that's not associated with sex, or historically was not associated with sex, and then HSV2. Now they're finding that a lot of people who have genital herpes are still only testing positive for HSV1. So now they're saying that they're interchangeable. So here's the deal with HSV1. 90% of the population tend to test positive for HSV1 because it is what all cold cells are tend to be HSV1. So, and there's nothing you can do about it. Your immune system gets low, and you can get an outbreak, around your mouth. And there's some people who actually outbreak a lot easier with a cold sore. There's some people who are like, I've never had a cold sore in my life. And that's because you have a really good immune system against HSV1. HSV2 historically tends to be with genital herpes. It is also associated with cancer, but less likely than HPV. HSV2, you could have an outbreak once in your life and never have it again. Or you can have constant outbreaks that you always need to be on medication for it because your immune system isn't particularly strong against it. Or you could be a person who had an outbreak once and then it only outbreaks when your immune system's super low, like during pregnancy. That's a really common time for people to discover that they have genital herpes, and also during chemotherapy. Now, here's the thing about genital herpes is that you could get it and it can lie dormant for years, and then your immune system drops and you get an outbreak. So the difference between HSV and HPV versus other STIs is usually STIs, you can kind of link it to a more recent partner. So the incubation period for getting chlamydia is about 2 to 3 weeks. So you could probably go back to 2 or 3 weeks or a month and think, okay, who did I have sex with last? Or who of my partners, could it be? And, you can narrow it down to calling those people. Whereas with genital herpes, you could have had sex or exposed to a genital person who had genital herpes and they were inflamed, or they were just shedding the virus, so they weren't even inflamed, in 1985, and you didn't get pregnant until 1996. And when you were pregnant, your immune system was just so low, you couldn't fight the HSV. That's when you had your first outbreak. And you think, oh my gosh, who gave me this outbreak? I have 4 sexual partners since I started having sex. It could be any one of those people. So that's something that's really important to understand about communicability of STIs. So STDs affect certain groups in greater numbers. Obviously, younger than 25, being part of a minority group. Also, the elderly, there's an increased rate in the elderly population. Residing in an urban setting, being impoverished, and using drugs. It's important for nurses to educate clients about ways to prevent communicable disease, even if you see a client who you wouldn't think would be sexually active, maybe because they're older or they're with their parent and they say, I don't have sex. Still really important to talk about it. And it's hard sometimes because some parents get really angry about you talking about prevention, and it's really important to educate parents that, discussing prevention and education isn't encouraging people to have sex, it's just good sense. A lot of STDs do not produce symptoms in clients for a while. We talked about herpes. Some people might never be symptomatic. They can still shed the virus and spread it to other people. Men tend to not have a lot of STD symptoms. So there will be men who could have gonorrhea for like 2 years and they don't have any type of genital symptoms, but they're spreading it to the female partners, which is why they actually do encourage regular screening for certain STIs. So gonorrhea and chlamydia is one of them, at least every 2 years in over the age of, I think, 17, to do a urine test. And I know for me, because of my population, and also Cincinnati has a really high syphilis rate, I test for syphilis every year. So aside from death and very serious complications of STDs are pelvic inflammatory disease, which can lead to infertility, ectopic pregnancy. It can also cause neonatal morbidity and mortality from spreading to the fetus, and then cancer. So other communicable diseases are the hepatitis. Hepatitis A, it spread through dirty water. There is a vaccine. They have now started regularly vaccinating for hepatitis A in children, and we have been catching up adults. So that's been really good. It used to just be thought that there would never be dirty water issues in the U.S., but there can be, and also in food. You can get contamination through food. And hepatitis A does eventually get better, and you can get rid of it. You can develop an immunity to it, but it still can be really dangerous. Hepatitis B is mainly transmitted through sex and exposure to bodily fluids. So it used to be mainly they would say, okay, all healthcare workers at least have to be vaccinated. Then they started vaccinating people before they went to college because there's increased risks of sexual activity in colleges. Now they give Hep B. It's on the they give Hep B at birth, and we also are catching up adults with it as well. Hep C is more likely to be transferred with IV drug use, so sharing of needles, whether it's drug abuse, or maybe you got a like a stick in the healthcare setting, but it can be transmitted through sexual contact. However, it's way less likely. In fact, they did a study. There have been several people who were sexually active with someone with Hep C for years, and they never transmitted it to their partner, because it's just less likely to get transmitted through a sexual activity versus a needle. Hepatitis C, there is some treatment. However, the treatments are still relatively newer. They're not always that safe, but you have it forever, and it goes in between acute and chronic phases. With Hep B, there isn't treatment, it's just symptom support, but you will eventually, I think 50% of people will actually get rid of the Hep B, and then the other 50% will be chronic. Anybody born before 1967, they just have a higher rate of Hep C because of dirty needles with tattooing, especially older men who were in World War I and II. Most World War I vets have passed. World War II, there's still plenty, so we test all adults born before 1967 for Hep C, and in community clinics, we test everyone for Hep C. So something that's really important with these communicable diseases is notifying the Department of Health. So if you have TB, syphilis, Hep C, it gets tracked by the Department of Health, and also they will contact a married partner. So if I get a patient, they come in, I have to test everyone for HIV at least once. They test positive for HIV. It gets flagged to the Department of Health, and the Department of Health will follow up with that person's partner if they're married. And that's just a law, because you want to prevent the spread of HIV, something as communicable and spreadable. And that concludes our lecture for this week. Thank you, and I will see you guys next week.